Hello, class. My name is Miss Merrill. I'll be guiding you through the next 8 weeks as we dive into the general clinical skills for medical assistants. Now, as a medical assistant, you will play a vital role in the clinical setting, assisting your clinician to provide patient centered care. Before we can dive in too deep, we first need to understand the regulations and standards that are in place for all healthcare facilities. So we'll start with lesson one, OSHA and healthcare worker safety, to give you an overview of OSHA and the vital role that they play. OSHA, the acronym OSHA, stands for Occupational Safety and Health Administration. They have a huge mission to assure safe and healthful working conditions for workers by setting and enforcing standards and providing training, outreach, education, and assistance. OSHA's regulations and oversight create safer healthcare workplaces, ensuring the well being of both the healthcare workers and the patients that come into the facility every day. OSHA covers most private sector employers and workers in all 50 states. Its protection applies to all federal agencies as well, but it does not find federal agencies. State and local government workers are not covered by federal OSHA, but they do have protections in states that operate their own programs. OSHA does not cover self employed workers or workplace hazards regulated by another federal agency, such as the Coast Guard or the Department of Energy. When it comes to setting safety standards, we can't give OSHA all the credit. They work with the Center for Disease Control and Prevention to ensure there are documented best practices to follow. The CDC makes recommendations and guidelines around specific health and safety practices. OSHA then establishes and enforces regulations based on the CDC recommendations. These standards cover various aspects such as exposure to hazardous chemicals, infection control, ergonomics, and even workplace violence prevention. If a standard exists, its guidelines must be followed. There's no way around that. If no standard is established, then the General Duty Clause takes effect. The General Duty Clause requires an employer to maintain a workplace free from hazards that are recognized as likely to cause death or serious injury. The employer has a legal responsibility to provide a safe working environment for you. To fulfill this, the employer must ensure the workplace is free from serious hazards by inspecting the workplace on a regular basis, finding and correcting any safety or health hazards that are found. They must provide safe and properly maintained equipment, accessible safety training for all employees, and they must inform employees about chemical hazards through training, labels, chemical information sheets, and other methods. Employers must provide the required personal protective equipment at no cost to workers. They must keep accurate records of work-related injuries and illnesses. Your employer cannot retaliate against you for using your rights under the law, and they must notify OSHA of work injuries or death. As a healthcare worker, you have a responsibility to comply with the procedures, guidelines, and regulations that are outlined in your facility's infection control. And this is to protect yourself, your coworkers, and your patients. Along with those responsibilities, you have rights. You have the right to risk free working conditions, training in your language, to review work related injuries and illnesses, along with getting copies of test results done to find and measure hazards in the workplace. You also have a right to file an OSHA complaint free from retaliation if you feel that there is a serious hazard in your workplace. I know this sounds like a lot, but there are tons of resources available to help healthcare facilities stay compliant. OSHA provides training, resources, and guidelines to healthcare facilities and workers to ensure they understand and can implement safety protocols effectively. This includes education on handling hazardous materials, infection prevention, and safe work practices. To keep us on our toes, OSHA conducts inspections of healthcare facilities to ensure compliance with safety regulations. In 2022, OSHA did over 31,000 inspections, scheduled and unscheduled. And out of the 31,000, there were over 6,000 that were from complaints. Not being compliant can result in some pretty hefty penalties and corrective actions to help alleviate hazards. These penalties can range from a little over $1,000 going all the way up to over $150,000 per violation if they're repeated. To help facilities stay compliant and avoid these violations and penalties, OSHA will help facilities identify and assess workplace hazards, requiring them to have safety programs and procedures in place to address these hazards promptly. OSHA mandates record keeping of workplace injuries and illnesses, which helps identify trends in areas where improvement may be needed. It also requires healthcare facilities to report severe injuries and fatalities. If you have any concern about your safety in your workplace, speak up. OSHA protects healthcare workers who report safety concerns or violations from retaliation by their employers. Workers have the right to report unsafe conditions without fear of adverse consequences. You can get more detail on this on OSHA.gov or contacting your nearest OSHA office.